Assalamualaikum viewers, welcome back to my YouTube channel, and today we will discuss the overview of the incised wound and the models related to it. So let's start. So what is incised wound? It is defined as an injury caused by a weapon with a sharp cutting edge when it is drawn across the skin, and the objects may be knife, razor blade, pieces of the broken glass, and etc. And the injury caused by these weapons vary in the sharpness according to the character of the weapon and the nature of the stroke made. Now, what are the characteristics of the incised wound? First one, the margins are clear cut and well defined and regular. Its length is greater than the depth, usually longer on the skin surfaces than the deep. Tissue bridging is not seen. Bleeding is usually profuse due to the clean vessel division. Bleeding इसमें हमारे पास profuse होती है. Edges may be everted slightly because of the skin elasticity. Edges इसमें हमारे पास everted होते हैं. Hair bulbs, vessels and nerves are sharply cut, and surrounding tissues show minimal bruising unless weapon is blunt edged. Dangers of the incised wound. This is very important. The danger is from the hemorrhage of the large blood vessels and air embolism. And another important feature of the incised wound is the hesitational or tentative cuts. These are the cuts made by the person with suicidal tendency, the person that commits to suicide, and in his body the tentative cuts are present while attempting the suicide. These are typically multiple, superficial, parallel and uniform in depth and are present on the accessible parts of the body. Now let's discuss some of the models related to the incised wound. So the first one is the model of the face and neck showing the incised wound, that is from left to the right, which is oblique in direction, called as the cut throat. At the commencement of the left side, there are multiple superficial cuts. As you can appreciate, there are multiple superficial cuts which are called as the tentative cuts or hesitational cuts, which is the key feature of the incised wound. Next is the model of the female showing a torso and oblique incised wound on the forehead. Forehead के ऊपर आप लोगों को incised wound नज़र आ रहा है, and hands के ऊपर भी आप लोगों को indication कर रहा है कि this is an assault case and the defense is offered by the victim. Forearms पे भी here and on the forehead you can see this is the incised wound. Next is the model of the anterior abdominal wall showing the multiple incised wound. As you can see in the picture, they are slightly deeper at their commencement and superficial at their termination. जो हमारे पास terminal superficial portion होता है, it is called as the tailing of the wound, which is also found in the incised wounds. This is the model of the back of the head showing the two horizontal incised wounds at the back of the scalp. So you can see these are multiple and parallel in directions. This is the model of the hand showing the incised wound on the dorsal surface of the hand, indicating the defense wound. So this is also an assault case. This is the model of the face showing multiple deep incised wounds on the forehead, left face and the neck. Additionally, there is a black mole on the left side of the face. So यहाँ पे हमारे पास इस मॉडल के अंदर multiple incised wounds नज़र आ रहे हैं which are deep in nature on the forehead, left side of the face and on the neck. This is the model of the knee joint showing multiple incised wounds which are horizontal and oblique in direction. Next is the model of the dorsum of the hand showing multiple incised wounds with cutting of the interphalangeal joint of the thumb. As you can appreciate here, this is the cutting of the interphalangeal joint of the thumb and the multiple incised wounds on the dorsum of the hand. Next again is a model of the posterior view of the head and neck, showing 4 horizontal incised wounds on the posterior aspect of the scalp. This is again the model of the head and upper torso, showing the 2 horizontal incised wounds. 1, 2. This is the 2 horizontal incised wounds on the back of the scalp. Now this is the model of the posterior aspect of the forearm, showing the multiple superficial incised wounds. As you can appreciate in the picture कि यहाँ पे हमारे पास multiple superficial incised wound presents हैं. So these were the models that were related to the incised wound, their features, characters, dangers, and important characteristics. Smash the like button, share it with your friends, and so that you never miss out our next video. Thanks for watching.